is the author of a book that every one of you needs to read called Saving Freedom. It's a textbook that tells you how to take your country back. Senator Demint.
Thank you, Matt. The New York Times just reported that 500 people showed up here today on the line. Well, I think you all know that the president has warned us that if we disagree with him, he is going to call us out.
He lied! He lied! He lied!
Okay, Mr. President, we are out. Ladies and gentlemen, welcome to Waterloo. This is a day that I've dreamed of for a long time. We stand together today in a critical battle for the heart and soul of America. It's not a personal battle against President Obama or a partisan battle. It is a battle between big government collectivism and freedom-loving Americans.
You today. When President Obama spoke before the nation on Wednesday, he repeated his promise that if you like your health plan, you can keep it. But this bill proves that's untrue. Take a look at pages 16 and 17. If you get your health plan through your employer has a grace period courtesy of the government, and then will be legally required to move you into the plan the government wants you to have. If you get your insurance yourself, you won't even have that grace period. You'll have to change to what the government wants you to have as soon as anything in your current insurance plan changes. That's right. And when you go to file your taxes, if you can't prove you're in that plan the government wants you enrolled in, you could be fined thousands of dollars. And get this, 18 months after this bill would be passed, the Health Choices Commissioner, appointed by the President, and a panel of advisors appointed by the President would decide what your health plan covers and what your doctor can do, how much leeway your doctor will have, and how much you are legally required to pay for this plan. Right? That's like a banker saying, sign here for this loan and in 18 months we'll fill in the interest rate and the terms of repayment. No deal! No deal! And this bill I'm holding, the first half of H.R. 3200, this is a medical assault on seniors. This bill is paid for partly with tax hikes, that's bad enough, but also with a $500 billion reduction in future Medicare spending, that's 10% down, at a time when 30% more people will be enrolled in Medicare as the baby boomers age. Those numbers don't add up, Mr. President. That means no more hip replacements, no more knee replacements, no more bypass surgery. It will undo 40 years of medical progress for our seniors. There is a better way. Mr. President, get rid of this 1,000-page bill and give us a 20-page bill in plain English, 20 pages. 20 pages. You know, the framers of the U.S. Constitution gave us an entire federal government in 18 pages. We want a 20-page bill that will do one thing, period. Provide coverage for Americans who truly can't afford health insurance. There are about 12 to 15 million of them. Americans who can't afford health insurance. We need to cover them so they don't lose their homes or savings when they get sick. And we can do that with that $500 billion in unspent stimulus money. It's sitting in a pot.